Good afternoon, my name's Dr. Smith.
Afternoon.
Well, thanks very much for your interest in our NAIROS study. I understand you've had some problems with your nose.
I have, for a while. I'm finding it's becoming a big problem with sleeping and with congestion in my nose. And I'm pretty tired of it now. My GP said that the inside of my nose might be bent. She said that an operation to straighten it might be successful, but it's not always. Is that what this is about?
Yes, it is. So we know that this procedure is often helpful, but not everyone's cured of their symptoms. For someone in your situation, the options you have are either to leave it as it is, to consider using a medicated nasal spray for 6 months, or an operation which we call a septoplasty. We currently don't know whether medical treatment or the septoplasty is better for patients such as yourself.
I don't really like the sound of an operation. What does the spray option involve?
So you spray the medicine, which is a low-dose steroid, into each nostril once or twice a day. It needs to be used every day for 6 months, otherwise your symptoms are likely to recur. Side effects are unusual, although it can cause minor nosebleeds and often causes a degree of dryness of the nose. So we also recommend that you use a nasal saline spray with this, as that helps keep the nose, the lining of the nose moist.
I've tried a steroid spray once before and I didn't think that it helped much.
So we know that sometimes steroid sprays don't work as well as we would hope, and that's sometimes due to congestion in the nose, which stops the spray getting to where it needs to get to in the nose. So that's one of the other benefits of using the salty water spray with this. If you use the salt water spray before the steroid spray, it will hopefully clear the nose out, allowing the steroid to get to where it needs to in the nose.
I don't really like the idea of taking steroids for a long time. My friend had to take steroids and he put on a lot of weight.
Okay, so that doesn't happen with nasal steroid spray. The steroid just acts on the nose in the area that it's needed. Very little gets absorbed into the body, and so we don't see the usual side effects that are often associated with tablet steroids that you might take by mouth.
What about the operation? What does that involve?
So the operation is done to correct the twist in the nasal septum. It will be done under general anaesthetic, so you'd be asleep, and the surgery is performed through the nostrils. Okay, there's no incision on the outside. And the operation removes any buckled cartilage or bone which is blocking the breathing passageway.
Is that all that's done in the operation?
We know that sometimes the lining of the nostril on the opposite side to the twist in the septum can become swollen. This particularly affects an area called the inferior turbinate, which is a cushion of nasal lining which warms and moistens the air as you breathe through the nose. Your surgeon may suggest that we treat that tissue in the nose as part of the operation in order to give the best possible improvements to your nasal breathing.
Are there any risks with the operation?
So the operation isn't usually painful. It's normal to have a bit of bleeding from the nostrils afterwards. Your nose is likely to feel blocked for a few days, and you're going to need some time off work, especially if you work in a dry or physically demanding job. The other complications are much less common. It is possible to get a build-up of a blood clot under the tissues of the nasal septum, and if that happens, that can cause infection or pressure on the tissue of the nasal septum, and this rarely can lead to a perforation or a hole in the septum. If that happens at the front of the nasal septum, then it can affect the support of the external aspect of the nose. So these are very rare side effects of the surgery.
I can't really say I want an operation, but I would consider it if you felt it would be worthwhile.
Okay, so this is what the NAIROS study is all about. We currently don't have much evidence or research that can tell us whether straightening the nasal septum for someone such as yourself is worthwhile, or whether it would be better to use the nasal steroid spray for 6 months.
So this study is to provide that evidence?
Yes, the Department of Health has put a lot of money into the study to see if we can work out which is the better option, either the operation to straighten the septum or the medical management with the steroid spray.
Oh, okay.
You see, for an adult such as yourself, the question as to whether a septoplasty is worthwhile is quite complex. Obviously, from your point of view, you want to know whether the operation is worth going through to improve your breathing and your other symptoms.
Yeah, and will it?
Well, we're not really sure. Yes, nasal surgery has been done for many decades, but when we look at the evidence for it, we discover that we don't really have a way of telling which patients or which symptoms would benefit most from an operation. And that's because the nasal blockage might be due as much to the lining of the nose than the position of the septum. And so medical treatment with nasal steroid sprays may work equally well or better. We're also aware that in a proportion of patients, some symptoms don't change at all, even if we do an operation or if we use the nasal steroid spray.
I feel like you've explained the options clearly. I would be happy to be part of the research, but could you tell me a bit more about what's involved?
Yes, of course. The idea of the study is for patients to enter one of two groups. One group would receive the septoplasty operation, the other would receive treatment with the nasal steroid spray. We collect information on each patient at the start of the trial, and then at 6 months and at 12 months after they join the trial. The main information that we're collecting relates to patients' symptoms following treatment, but we'll also be performing some tests to measure the flow of air through the nasal passages.
So how would I know whether I would be part of the septoplasty group or the medical management group treated with the two sprays?
So you would be randomised to a group. That means that neither you nor I decide which group you go in, but a random allocation will be organised by the university who are coordinating the study.
So if I agreed to take part today, would I find out which group I'm in?
Yes, if you were happy, we could arrange that today.
I suppose my worry is that if I'm not in the operation group and I still get the problems, that I could be no further forward.
Yes, we appreciate that. And to be honest, that's why this study has always proved difficult to run previously. However, for NAIROS, we predict that over the 12 months of observation in the group treated by sprays, some people's symptoms will improve. So these patients will be glad that they've avoided having surgery. On the other hand, if after 6 months a patient in the spray treatment group is still getting lots of problems, we will be able to offer them the opportunity to have the septoplasty operation if they want. This could be a choice at 12 months as well. Every patient treated with sprays will really give us useful information, even if they eventually opt to have the surgery after 6 months.
That does seem reasonable. I would be happy to be part of that, actually.
But would you also be happy if you were randomised into the surgery group?
Yeah, and I guess that's key for getting patients to agree to the study. I'd have to be happy with either group that I was put in. I would be comfortable with that. Is that all the information that you need from me now?
We plan to give patients questionnaires at the start of the study and every 6 months after that. These questionnaires look at nasal symptoms and general health. They're quick to complete.
Do I have to come back to the clinic for that?
Yes, we will want to see patients back in the clinic after 6 months, and again for a final visit after another 6 months. Again, this would give patients the opportunity to opt for a septoplasty if they wish to.
You mentioned the cost of treatment. How do you measure that?
So that's quite complex. So it might seem like the only cost in the trial is the operation, but actually we need to look at all costs involved. So that would include visiting the GP with symptoms. It would include the cost for the steroid spray and the salt water spray. But it also includes the cost to society for a patient not being able to function at their best because of their symptoms, and also the impact that it has on their family. So we've got specialist researchers in the university who will gather this information and analyse it.
I'd never thought about it like that, especially not how it affects my partner.
So that's a brief explanation of the NAIROS airway blockage study. It's a hugely important question for us to look at. I'm very grateful for your interest. However, you must know that this is a voluntary study. You can withdraw at any stage if you wish without having to give any reason.
No, I'd be happy to be involved, thanks. What now?
Well, I know that you've previously had the information sheet about the study and have had time to think about it. So we can go ahead and recruit you today.
Okay.
Great. Thank you for supporting NAIROS. I will take you through the consent forms and introduce you to our research nurse, and she will ask you to fill out the questionnaires before we go ahead and randomise you to the treatment.
Okay. Thank you, Doctor.